Hello. We're going to be doing some med pass today, and the first thing that we need to do with medication administration is check the order against the physician's order sheet. So that's what I'm doing right now. I first check to make sure that my patient's name is the same, which it is, Noel Martinez. I need to make sure that the date of birth is the same, and it is. In hospital, you would check also medical record number. Okay. Also on the physician's order sheet is the allergies, and this patient has no allergies. So next, I'm going to check the medication, and this is today's date and the time the order was written. The medication, the first medication is metformin, 1,000 milligrams by mouth daily, and then I check to make sure that the time to be given is correct, so that would be daily. The next one is azithromycin, and I make sure that that's what that is, 250 milligrams by mouth BID, and it is 9 and 21, so that's BID. The next one is multivitamin, 1 tablet by mouth daily, and then that is at 9 o'clock. Finally, we've got an acetaminophen order that's 350 milligrams by mouth every 4 hours as needed for pain, and that's what that is written on there. And then the physician's order is there, and so as the nurse, I'm going to acknowledge that this was correct according to my MAR. So you write noted, and then your name and title, and then the time and date and time. And that's checking off the order. Okay, next we're going to be preparing our medication collecting supplies, making sure that we have everything before we go into the patient room to pass medications. So first, I'm going to wash my hands, make sure that I have gloves, my med book, because I want to make sure I know my medications. And at this time, I would probably look up any medications that I was unfamiliar with as well. I make sure that I've got a cup, or that there's a cup in the patient's room. Make sure I've got med cups to make sure that I can pass the medication. If necessary, I may need a pill cutter or crusher, depending on the patient that I'm giving these medications to. My pen, my MAR needs to come with me so that I can identify my patient. And then I would get my medications, which in this instance are in this drawer. And I'm going to check with my medication and my MAR to make sure I've got the right thing. So my first thing that I need to get, my first medication is metformin, 1,000 milligrams PO daily. So right here I've got metformin, and by checking it, I noticed that I only have 500 milligrams per tablet. So that lets me know that I need to get 2 tablets for this. So I always set it up here and I check metformin, with the 2 500 milligrams, that equals 1,000, and they are pills, and this is not open packaged. The second thing I need is azithromycin, and so I look in my bin and make sure that I've got azithromycin, and I check that with my MAR, and I've got 250 milligrams. I'm going to give that twice a day, and it's 9 o'clock or 9:30 right now, so I'm going to be giving this medication. The third scheduled medication is a multivitamin, and so I pull my multivitamin, and they're just 1 tablet. That's how they're ordered. So I put this up here, multivitamin, make sure that the tablet or the package is not open, and the expiration date also I should be checking for. Finally, the next one is a PRN medication. So when I go in, I'll ask her if she needs anything at that point, but right now I won't pull that. Now I want you to make sure to know that I've checked these against my MAR. I'm also going to be reading them to the patient and letting her know what she's going to be getting, but I don't open the medications until I go into the room with the patient. All right, now next we're ready to go in. Okay, next I'm ready to go into the patient room, and I do all of my safety and infection control things as I enter this patient room. And I first wash my hands. And I greet the patient. Hello, Mrs. Martinez. I'm Erin. I'm going to be your nurse today, and I'm going to be giving you your morning medications. I first need to identify you. If you could give me your arm band so I can see and check you. And can you tell me what your name and date of birth is? And I see that it says Noel Martinez, 6179. And I check that against my MAR, which says Noel Martinez, 6179. And that's correct. Let me go over the medications that the physician has ordered with you for this morning. I have metformin, 1,000 milligrams, and I'm supposed to give that to you by mouth this morning. And what that is it's a diabetic medication, anti-diabetic medication that'll help to control your blood sugar. That's 2 tablets I'm going to be giving you. The next one is azithromycin, and that's 250 milligrams, and it's also a tablet, and that is an antibacterial, so an antibiotic. Finally, I have a multivitamin, and it's just 1 tablet that I'm going to be giving you, and that's just to give you your vitamins for the day. All right, let me sit you up, make sure that you are in a good position to take medications. At this point, if you didn't know, and if the patient was coherent, you could ask them if they have any swallowing problems or issues with swallowing tablets. You do want to make sure that they're sitting up quite a bit to make sure that they're taking full advantage of swallowing correctly. The other thing that you want to ask for patient preference is whether they want to take 1 pill or all of the pills, or how many tablets they want to take at one time. So Mrs. Martinez, do you like to take 1 pill at a time, or a couple of pills, or all of them at once? Okay, you just want to take all of them at once. Great. So I'd go ahead, wash my hands again, apply gloves, make sure that I've got water in her glass for her. Do my last check there, and then I would open each medication. And I like to really have gloves on, that way if the pill doesn't want to come out, I can feel free to grab onto it without touching it with my hands. That's your multivitamin, this is your azithromycin, and your metformin. Okay. So here you go, I've got 4 tablets for you. Do you want me to help you give it or take it? Okay, give her the 4 tablets and then some water. And then ask her if she has any questions. Then I'll evaluate her afterward if necessary, so check her blood sugar if needed. If I were giving her a medication that required anything beforehand, like a blood pressure, I would do that beforehand as well. Finally, then I would document all the medications that I gave today on the 5th, which is today, at the time that I gave it. Okay, and then I would wash my hands.